Check 1, 2, 3, 4, 5, 6. Is it coming in clean? Check 1, 2, 3, 4, 5, 6. Okay. Okay. Just didn't know. Terry, you're good.
Let me know when you're ready. 1, 2, 3, 3, 2, 1. Check, check. 1, 2, 1, 2, 1, 2.
I'm just going to put this here. Because every time I do something.
Do you want me to check all of you again?
No, I think I'm okay. I've been checking it and it's moving, so I think I'm good.
Do you want to hear? One, 2, 3, 3, 2, 1. Check, check. 1, 2, 1, 2. 1, 2, 1, 2, 3, 4, 5, 6. Check, check, check. 1, 2.
All right, good morning, everybody. Morning, everybody. So we're here today to introduce the Rochester Police Department's participation in the Leave Behind Naloxone program. Far too often in our community, we have far too many people dying from overdoses and suffering from overdose-related illnesses and injuries associated with those. So the Rochester Police Department has been working closely with Monroe County Department of Health, with the HIDA, as well as other agencies that are out there. So I'd like to introduce behind me, I do have Chief Smith to talk more about the program, as well as we'd like to welcome County Executive Bello, Dr. Smith from the Monroe County Department of Health. We also have Lisa Warden and James Hawley from the Overdose Response Strategy. So we'll start with Chief Smith to talk more about our program.
Thanks, Craig. I'd like to thank our guests for being here with me. The mayor is traveling. He was unable to be here. Today, we're proud to be one of the first police agencies in Western New York to participate in Leave Behind Naloxone. This year alone, over 100 people have died in our community from suspected overdoses, more than double than have been killed by violence. We always talk about the steps we are taking to save lives from violence. Now we are taking this ambitious step to save lives from opioids. The Leave Behind Naloxone program, in coordination with the Monroe County Health Department, will provide our officers with kits to be dispersed to high-risk individuals in our community. High-risk individuals include not just overdose survivors, but people with a history of overdosing, high-risk users, and then also their friends, families, coworkers, or anyone else in a position to possibly use these life-saving supplies. Each kit will contain 2 doses of naloxone, also known as Narcan, as well as information on how to use it, harm reduction strategies, and resources to seek assistance. We will begin rolling this program and the kits out in early November with a plan to implement department-wide by February. Again, I'd like to thank all of our partners in reducing opioid deaths, including the New York, New Jersey, High-Intensity Drug Trafficking Area Representatives, or HIDA, as the captain mentioned, for bringing this program to our attention, the Monroe County Health Department, and the public health analyst Lisa Warden from Overdose Response Strategy. Without their assistance, this life-saving program would never have become a reality. Now I'd like to introduce page 2. I do have to thank Commander Dessain, who's over here, the newest member of my team, for spearheading this program within the RPD. Every kid is a chance to save a life and provide hope to those battling a substance use disorder. The actions of our officers go beyond enforcement. They represent compassion, empathy, and a commitment to helping our community. And now, without further ado, I'd like to introduce the county executive.
Thank you, Chief. Good morning. It's wonderful to be with all of you here today. I want to start by thanking Chief Smith, all the men and women of the Rochester Police Department who go above and beyond every day to protect the health and safety of this community. So I want to thank you for all of the work that you do here. And I also want to thank you, as it pertains to this program, for this new innovative approach as you're thinking about the health and safety of our community and how we can be innovative in reaching people. As the Chief said, oftentimes you think about the police work in terms of gun violence and other types of violence in our community, and here leaning into the opioid epidemic and the health of this community, and how the police department can play a role in saving lives in our community from people who are afflicted with a substance use disorder is a real new innovative approach, and I want to thank you for your willingness to lead in this area. The scourge of the fentanyl and opioid epidemic claims far too many lives in our community, and as the police will know, because you're oftentimes the first responder to those overdoses, that this loss of life is preventable. And that's why we've made it our mission to use county resources, to utilize settlement dollars that we have from the opioid companies to improve our community's response to the opioid crisis. And that includes the better coordination of services and programs that are offered by our community partners. Several years ago, we started with the creation of the county's 24-hour Improving Addiction Coordination Team. We call it our IMPACT Team. Since its inception, the Impact Team has worked with the community, engaged individuals and families struggling with substance use disorder. The leader of the Impact Team, Dr. Tisha Smith, is here, so I want to thank you, Dr. Smith, and your team for the work that you do every day to save lives. Dr. Smith and her team are connecting people in crisis with services, support, and treatment, and working towards the goal of reducing overdoses and overdose-related deaths. Earlier this year, I had the opportunity to work with our Impact Team and go for essentially a ride-along with the team and be able to shadow them for a day and spend quite a bit of time out on Lyle Avenue. We were on Dewey. We went up to the town of Irondequoit for a naloxone training. And I got to see firsthand how the men and women who work for the Impact Team engage with individuals who are really in need of help, who are drug addicted, they're unhoused, and the way they connect them with life-saving treatment like naloxone. They provide food, they provide access to other social service needs, and then also engage with them and try to get them on a path to recovery and healing. And I think that's one of the most important things, because what we see, you know, it's one thing to talk about people's statistics or talk about numbers, but at the end of the day, those who are out there struggling in our community, they're not numbers, these are people. These are people who have families, and these are people who are struggling with a disease. And when you can step back and look at the humanity that's involved here and how we can save a life, and when you have the resource, you have the compassion that the men and women of the police department here have, and they have the resources to be able to provide this life-saving medication to people and prevent a death, is really an incredible thing. I got to see it firsthand, like I said, with our Impact Team handing this medication out on the streets, involved in the training on how to use this medication safely. The expansion of being able to do that by working with RPD is going to save another countless number of lives. And this is a data-driven approach. When we started placing naloxone around this community, we installed about 550 naloxone boxes. And, you know, we put them in places, private businesses took them, commercial real estate stores, retail stores, restaurants, bars. All of Monroe County's 22 parks have naloxone boxes as well. And since July of 2022, we've distributed tens of thousands of doses of naloxone. And we do that because we know it saves a life. And this new program that's being announced today by the police chief goes even further by putting that naloxone directly in the hands of people who may need it the most. Because, like I said, police are the first responders. These are oftentimes the first people on the scene when you call 911 because someone you know or someone you see is overdosing. Police are oftentimes the first ones there. Sadly, Rochester police officers are called on to respond to these overdoses, and they need the tools available to help save that life. So under this partnership, RPD officers will distribute those small kits that you see here directly to high-risk individuals and their families. The kits contain both naloxone, and just as importantly, though, it contains information on seeking assistance for addiction services, because following an opioid-related emergency, the Leave Behind kit will be offered to family, friends, bystanders who are present at the incident. And it's essentially taking the work of Impact and it's deploying it more into the community in this partnership. So again, I want to thank you, Chief Dave Smith. I want to thank the members of the Rochester Police Department, Mayor Evans, and particularly I also want to thank Dr. Tisha Smith and her team at the Monroe County Department of Health for coming together to make this possible. Increasing naloxone access has been identified as a primary strategy. This is a primary strategy to reduce opioid overdose and death, and it has led us to have one of the most aggressive and ambitious naloxone distribution efforts in all of New York State. Simply put, the Leave Behind naloxone program is going to save lives. Many people who struggle with an opioid addiction require multiple supports to address a wide range of needs. So these kits are also that educational information I talked about. This is going to have that contact information for the Impact Team. They're available 24 hours a day. We have a hotline. We have people who are working out there in the streets. This is now another effort where RPD can help us connect people in our community with those services. So again, thank you to everyone for partnering with this. No one group, when you're trying to have an impact on an issue that is so big as the opioid crisis and affects so many lives, no one organization can do this on their own. Monroe County certainly can't do this on our own. Our healthcare systems, our hospitals, our impact team, RPD, the city of Rochester, you have all these organizations that are trying to save lives every day. But this new program, this innovation between Monroe County and the city of Rochester and the RPD is bringing those organizations together. It's tearing down barriers, it's breaking down silos, and it's coordinating these efforts so we're all not just out there independently, but we're working together to save lives, and I know this new initiative will do just that. So thanks again for all the partnership. And then it's my pleasure to introduce next up Dr. Smith, who oversees Monroe County's impact team, the work, the counselors who are out there every single day and installing the Naloxone boxes and connecting those who are struggling in our community with the help and support systems that they need. So Dr. Smith, come on up. You're welcome.
Good morning, everyone. Thank you so much for this opportunity to speak about this wonderful program. The Leave Behind program started with the New York State Department of Health. And due to the tenacious work of people from the health department, Jessica O'Connor and Brooke Bush, we have embarked upon this new partnership with the Rochester Police Department. This is another way, as the county executive mentioned, to continue the county executive's mission of getting naloxone, which otherwise known as Narcan, into the hands of members of our community, because as the county executive mentioned, naloxone does save lives. By having first responders such as RPD provide Narcan to the hands of people who need it the most, this is another way, another strategy for us to help alleviate some of the problems that we've had in our community as it pertains to overdoses. I want to thank HIDA for their guidance on this project. Thank you to Commander Desane and Chief Smith for their willingness to participate in this program, and I'm looking forward to expanding our partnership in other ways, again, to all help alleviate some of the problems that we have in our community. The men and women of the health department stand poised to help in any way possible, and I just want to thank the county executive for this wonderful opportunity to expand the work that we do in the Monroe County Department of Public Health. So thank you again for this opportunity, and thank you to the men and women of the Rochester Police Department for participating in this program. Thank you. I'd like to introduce Lisa Warden from Overdose Response and Strategy. Thank you.
Thank you, Dr. Smith. Just a little bit of background about who we are, and I think of myself and Jim. We are from the Overdose Response Strategy. That's a national program that's funded by CDC and the Office of National Drug Control Policy. And the whole purpose of this program is to promote public health and public safety collaboration in overdose prevention work. As part of our role, each state in the U.S. is assigned a CDC Foundation public health analyst like myself and a drug intelligence officer from HIDA like Jim to work with local communities to implement innovative and evidence-based overdose prevention strategies where public health and public safety intersect. So we're really thrilled to be here. Our whole purpose in being here is to really applaud Rochester PD and the Monroe County for their efforts in implementing this Leave Behind Naloxone program. In August, Jim and we convened a session across New York State of all New York State law enforcement agencies to promote the implementation of Leave Behind Naloxone. Shortly after that session, we got a message from Commander Desane saying, I've consulted with the chief, we are ready to proceed, what are our next steps? And as the ORS team for New York, we're thrilled to hear that type of response to that type of initiative. So I want to address Chief Smith and Commander Desane and really applaud you for your leadership and your visionary approach in implementing a life-saving program. And we say, why is this so important? And why is it that people who are, why do we call it life-saving, and why do we say these people are at higher risk? The reason is that every time a person overdoses, their risk of overdose fatality increases. So the fact that you are putting life-saving tool of naloxone into their hands can prevent future overdose and, more importantly, overdose fatality. So we applaud you for your efforts, and we also want to applaud you for being so proactive in your approach, because this sends a very powerful and important message to your communities, especially people who are struggling with substance use disorder, and their families and their loved ones. Oftentimes they're hiding in shame and stigma and don't access these vital resources. So the fact that you and your officers are putting this into their hands and showing a compassionate response, we just can't applaud you enough. And to the county executive, I'm sorry to turn my back on everybody here, but the county executive, Bello, and Dr. Smith and your impact team, we also applaud your leadership. This is a really impressive, and the outreach that you spoke about from the state level, we have been impressed with what we've seen with Monroe County in their naloxone expansion efforts. You have a clear and deep commitment to reducing overdose deaths in your community, and that's evident. So we commend you for your partnership with public safety, because that's key, right? This public health and public safety partnership, because people need not just naloxone, they need linkage to care, they need resources, they need compassionate care. And I want to applaud you, County Executive, for your impressive and enviable impact team. I wish every county had that level of resource in their community embedded in the county to mobilize into the community and provide compassionate, non-judgmental care. It is remarkable. So we're here simply to say kudos to you and your outstanding work. We know that great leaders open the door to great work, and you both have done that, so thank you. So with that, I want to now introduce the other half of the public health and public safety team, my partner, Jim Hawley, for the overdose response strategy.
Hello, everybody, and thank you for having me here. Lisa, stole all my material, so my comments are going to be short here. We saw Jessica, Lisa and I, present up in Albany at a harm reduction conference, and we were so impressed with the work that was going on in Rochester. We were like, we've got to get with Monroe County. We go all over the state, and the work that the impact team was doing here was phenomenal. Then comes this Leave Behind Naloxone, and then RPD jumps right on board with Commander DeSaint. And I just want to thank you guys. You may not realize it, but since Lisa and I did that presentation with Dr. Daly from Albany Med, we've had about 15 law enforcement agencies across the state reach out, to follow up on this. But you guys are the first to implement it. You really are aggressive, and I commend you for that. And this is just the beginning. When you start sitting down at the table with your public health and law enforcement together, you just start exchanging ideas, and great things will come from that. So once again, I commend you for being aggressive, for implementing this, and good luck, and if you need us, we'll be here in the future. Thank you.
Great, thank you, everybody. And now we're open to a few questions if anybody has one. Sure.
So that's a great question, and that is the reason why we held the informational session in August. We recognize that there's a real gap in having a sense of how many agencies are doing it, more importantly, giving them resources and tools to help implement. So I don't have an answer to your question, but the informational session that we attended, there were over 100 law enforcement representatives attended. And as Jim said, after that outreach, we know at least 15 reached out to us, but we know there are others that are in place in the county as well, in the state as well. So we don't have a number, but our goal is to get a handle on that number and increase it throughout the state.
Yeah, so what these are going to be used for, so there's lots of agencies out there. For example, our partners in the fire department, following an overdose, have access to Narcan and Naloxone and kits to leave behind at overdose scenes. And I believe the hospitals offer some resources as well. What this is looking at is beyond overdose scenes, if those resources aren't available at the scene themselves, looking at our officers encounter high-risk individuals on a daily basis that don't necessarily overdose to a point where Naloxone or Narcan is being used. They don't necessarily at a point to where they're seeking medical intervention from the ambulance. But we know from working with them and talking to them on a daily basis or a weekly basis that this person is an avid user, this person is seeking help or not seeking help for whatever reasons, but we want to be able to get the Narcan into that person's hands, so God forbid, if they do have an overdose emergency, that they have it available. And then what we're also doing is getting it into the hands of people around around those high-risk individuals, whether that be family members, whether that be friends, associates, even if it's leaving them with some people at some of the homeless camps that we work our way throughout the city where we know substance abuse is an issue, coming up with different ways where we can make it more readily available around the inner circles of those that are in those high-risk situations. We good? Yeah, of course. Sorry.
I'm not sure this would be for the chief or whoever would want to comment on it, but just in terms of how this might also help to rebuild the trust between RPD and the community at large, for the general community as well.
Yeah, so certainly, we've got to look at the opioid problem in multiple different ways, but the two main ways, typically when people look at law enforcement, we're here to enforce the laws and to go after those that are providing that fentanyl, providing the drugs in our community. And we have our special investigation section that's out there that targets the dealers, that targets the suppliers, that targets where it's all coming in from. But at the same time, there's people with significant substance abuse issues. There's people that can't break those habits. And again, as the chief said earlier, we talk about violence all the time. We're in the 40s for homicide victims. We're over 100. The county, I just pulled up the numbers as of a few weeks ago, was 122 people have died from suspected overdoses just this year alone. And so we have to look at the life-saving aspect of it as well. And as police officers and first responders, we're out there interacting with overdose survivors. We're out there, unfortunately, with overdose fatalities and those circles around and the people that are constantly using and have those addiction problems. So as first responders, we're in a position to provide a resource to those communities, and that's what we're aiming to try to do. So looking at it from a multifaceted approach, number one, going after those dealers, going after those suppliers, and limiting the amount of these deadly drugs that are available, but we also have to help those that are addicted and can't get out of using them. So providing not just the Narcan, these kits also include addiction services, information, how to reach out to get those addiction services. It includes information on harm reduction, how to use safer, right? It provides all of that together because we also have to save lives at the street level as well. We can't just look at it in the networking level.
Just to clarify,
Yeah.
the officers will be administering the...
So our officers are already issued Narcan, okay, and they provide that life-saving measure constantly. I don't even have a number to it because it's just become routine for our officers to administer Narcan and save lives out on the streets. That's a routine thing, whether it be our officers, whether it be the fire department, whether it be AMR and the ambulances that are out there. That's what first responders do. This is now getting it more readily accessible into our community before they're waiting for an officer to respond or waiting for the fire truck to respond or waiting for the ambulance to respond, that more and more people have it to provide this life-saving measure at that street level. So we're going to, so the funding, I'm going to leave through the county because the county is the one, the health department is the one that's graciously providing us the resources in these kits. We're going to start rolling it out in our Clinton section first, which is the northeast section of the city. Rollout days of November 1st is we're going to start the training within that Clinton section, and then we're going to start expanding it to other sections as more and more kits become available. So we're getting this going. We just went to meetings on this, August, Commander? Started this in August, and by November we're going to have these kits produced and start rolling them out as quickly as we can into our community and into our officers' hands. So we've got 600 sworn officers, around 350 or so are in patrol. Last check, right? Around 350 in patrol. And so at least 350 as they start to roll out, and obviously we'll be able to restock them, and we're going to start, right? We got to start in Clinton section, which I believe is around 100 officers, and we're going to build from there. Cool. Thanks, everybody. Appreciate it.
Yeah, nice job.